Okay, so our next patient is from Massachusetts. He came all the way for a revision rhinoplasty. He had it done 2 years ago in Massachusetts, but he still has a hump. So he's not happy with that, and it seems to be mostly bony hump. So let's see what we can do to reduce it, and we'll take a look. So we have a 53-year-old male who's had rhinoplasty 2 years ago, and he's here for a revision rhinoplasty. He came all the way from Massachusetts. So his rhinoplasty 2 years ago went well, but he still has a hump, and that was his main concern going in. So now he presents, and you can see there's a deviation in the bony portion as well. And as we go around and you keep looking, you'll see the hump, and it's only in the bony portion, it's not in the cartilaginous portion. So when you look in there, you can see that the cartilaginous portion is pretty good. Coming down from the radix, there's definitely some elevation. And when you palpate, you can really tell. Now looking this way, you can see there's more of it towards the right side, right there. More of it over here. You can even see a little particle. You see this? Yeah, little tiny bony particle as well. So we have to try to bring it down in a conservative fashion, and that's all that's needed. Just a hump. There we go. Perfect. Let's get to work. Let's give him our best. Came all the way from Massachusetts. Okay, so here's the plan. I'm drawing everything, and I want to show you with a close-up. So as we get close, you'll see that I marked the midline, and there's gross asymmetry from the lip to the tip, and then coming along this way as well, as you can see from the top a little bit, midline. And you can see how there's a bulge right from here to here. And this asymmetry where this is a bigger bulge, this is a smaller bulge. And we don't want a smooth look, so we have to reduce it in a conservative way. So plan is going to be to use just some rasps, and if with the rasps we can bring it down perfect. If we feel it's not enough, then maybe I will do an intermediate osteotomy on this side, only on this side, see what I can accomplish. If it goes in enough, we are good. If not, then we can go down to the low lateral osteotomies and combining them with the medial osteotomy. That's going to be the last resort if we have to. So let's start with this first. Fantastic. Okay, so we have finished the rasping. We use a small rasp that is right here, and we got a lot of bone that I want to show you. So if you could have that, please, and you can come and take a look in here. So if you look in there, this is all bone right there, except for one thing, there might be some soft tissue, but tons and tons of bone particles. Now let's take a look. So we only did, if you look from above, we only did right this portion right here. So you can see how this has gone in. This is still a little bit protrusion right here, right there. But this has gone in significantly. So now all we have to do is bring this in and then make a judgment call whether we need to take off more from the top here or not. I don't think we'll have to, because this is giving a very nice contour. So I'm pretty happy to get a little more here on this side. Second look, and then we're done. Thank you. So the hump is gone, and all we had to use was just two instruments, literally. This one, which is a very tiny rasp, and a hemostat to achieve the axis in there. And then after rasping with this one, we get a lot of bone, and then filing it down with the other one that's really fine. Where did it go? Right there. That's the other one that's really fine compared to this, to just get rid of any irregularities. That's done. So now if you come take a look, I want to show you from the side view from here, and you can see the hump is gone. There's no hump. And then when you come from above, you'll see that it's equal on both sides. So you can see that the hump that was more on this side is equal to this side. So now you have a strong nose and it's straight without the hump. Very good. Thank you.